Good afternoon and welcome to today's seminar. We're going to take a few moments to let those who are planning to join sign in. While you are waiting, we would love for you to please share your name and what brings you here to today's seminar in the chat. Please be sure you're sending that to all panelists and attendees. Thank you again for joining, and we'll be beginning momentarily. So once again, just a few quick housekeeping notes before we begin. A reminder that all of the attendees have been muted, and we are encouraging questions and active dialogue either in the chat or the Q&A function. We will be actively monitoring both the chat and the Q&A, so please leave your comments and questions and know that we will be reserving time at the end of the seminar to address any questions or comments that come in. Before we begin, I want to take the opportunity to introduce the director of the Schubert Center, Dr. Anastasia Dimitropoulos, who is joining us today and has a few opening remarks. So thank you again, Dr. Dimitropoulos, for joining, and we're going to get started.
Thanks, Mary Beth. Good afternoon and welcome, everyone. We're thrilled to have so many of you joining us here this afternoon. As Mary Beth said, I'm the director of the Schubert Center for Child Studies, and at the Schubert Center, we bridge research, policy, and education for the well-being of children and adolescents. We do this by advancing understanding of children's engagement in everyday life, including families, peers, neighborhoods, and communities, and within historical and cultural contexts. We do this by employing a multidisciplinary approach and commitment to community collaborations among researchers, policymakers, and practitioners, and by fostering academic excellence and leadership in childhood studies and child policy. Today's event is co-sponsored by 4C for Children, Action for Children, Child Care Resource Center, Corporation for the Ohio Appalachian Development, Early Childhood Resource Center, Groundwork, Ohio, Hope Toledo, Invest in Children, Ohio Association for the Education of Young Children, Ohio Child Care Resource and Referral Association, Pre for CLE, Preschool Promise, SWOAEYC, the Centers for Families and Children, and Starting Point. Thank you to all of our co-sponsors. Before I turn the platform over to Dr. Friedman, I'd like to briefly share some of our upcoming events. Details and links to registration for all of them can be found on the Schubert Center website. On Friday, February 26th, we are joining with Metro Health for a screening of the short documentary film, Healthy Students Equal Strong Learners, and a discussion about the positive impacts of school-based health centers. On Tuesday, March 2nd, as part of the Community Health Resource and Practice Seminar, representatives from Metro Health and the Legal Aid Society will discuss how improving children's health requires more than just medical care. We hope you'll join us again for these and other events this semester. It is now my pleasure to introduce Dr. Darcy Friedman, who serves as the director of the Mary Ann Swetland Center for Environmental Health and served as the principal investigator for the Ohio COVID-19 childcare study. Dr. Friedman will be sharing an overview of this study before we begin our conversation with our discussants. And I'll just add that from the Schubert Center, we have been very excited to share and collaborate with the Swetland Center on this project. Welcome, Dr. Friedman.
Thank you so much, Dr. Dimitropoulos, the Schubert Center, the Swetland Center, and our seminar sponsors for organizing our session today. And a special thank you to almost 200 people who are currently online, and we had over 300 people RSVP, so we are expecting a few additional participants today. Many of you are childcare providers and working to support childcare in our state. On behalf of all of us, we are deeply grateful for your commitment to serving children and families across our state. We're always grateful, but we're especially thankful during these times. I also want to thank our funders and partners, the Ohio Bureau of Workers' Compensation and the Ohio Department of Job and Family Services. Next slide. For the purposes of this seminar, I want to provide a brief overview of the Ohio COVID-19 childcare study. And it's exciting. I saw a few people in the introduction say you were in the study. So welcome and thank you. Launched in July of 2020, it was a rapid response study supported by a cross-disciplinary research team with expertise in child health and well-being, environmental health, epidemiology, and infectious disease. And I do want to remind you that while July of 2020 normally would not have felt that long ago, but if you think about how much has happened with COVID, in some ways it was a lifetime ago when we actually planned this study in terms of COVID-19. It was a two-part study that had a goal of looking at statewide examination of COVID-19 cases among childcare staff and children attending childcare, and an in-depth mixed methods analysis of childcare programs in 10 counties in Ohio. And you can see these on the slide. These 10 counties have about 2/3 of all the childcare programs in the state of Ohio. Next slide. We designed this study, again, during the summer of 2020, when little was known about the impact of COVID-19 in childcare, to examine these research questions. One, we wanted to learn about the trends of COVID-19 transmission among childcare programs. Two, the factors driving or limiting the spread of COVID-19 in childcare settings in diverse contexts in Ohio. We wanted to understand perceptions of risk and safety among parents and caregivers and workers from childcare programs following the reopening after COVID-19 was declared a public health emergency. And lastly, we were interested in levels of stress and coping in response to COVID-19. Next slide. The first part of our study had a statewide focus, looking at data from the JFS Serious Incident Reporting System. Many of you are familiar with this system. It was an existing system for reporting any kind of serious incident or injury, such as infectious disease. This system captures self-reported COVID-19 cases among staff and children affiliated with childcare programs in the state. And as a part of the study, we received aggregated county-level data on a weekly basis. And we received data from March until January 1. The second part of our study allowed for in-depth examination in the 10 selected counties. This included many different approaches to data collection, such as surveys, a weekly health attestation to report common symptoms, COVID-19 testing for parents and staff. And at the time of our study, we were not able to offer a self-administered option for testing for children. There was not anything on the market at that point in time. And lastly, interviews and focus groups hosted by Zoom. It's important to note the timing of data collection given the rapidly changing nature of COVID-19. For example, nearly all of our data were collected prior to the FDA approval for the first COVID-19 vaccine in December of 2020. We worked with the Ohio Department of Job and Family Services to identify programs who were invited to join the study. To be eligible, childcare programs had to be a JFS licensed childcare center or family childcare home provider, open at the start of the study in August of 2020, located in one of the 10 pre-selected counties, have 5 or more people in total, including staff and children, and have the ability to email both staff and parents, given the need for web-based study recruitment due to physical distancing guidelines. A total of 46 childcare programs fully enrolled in the study. Of the 46 childcare programs enrolled, most self-reported they had less than 20 staff and served less than 100 children. About 17% of the programs self-reported they predominantly served African-American families. And in total, there were 228 staff and 242 parents and caregivers who participated. Taking a brief look at the study enrollment, about 40% of the staff at the sites were enrolled in the study. Racial demographics of the staff mirrored state trends, with about 79% identifying as white and 14% as Black or African American. The majority of the participants were classroom teachers, teacher aides, or administrators. About 15% of the parents and caregivers from the 46 programs enrolled in the study. Racial demographics of the parent and caregiver participants in the study underrepresented demographics for the state for African Americans, with about 7% identifying as Black or African American versus an average of 13% for the state. Most parents were working in business, healthcare, and education sectors. And now I'm going to review a few of our key findings. Number one, we learned that childcare programs can be safe. As you can see, less than 1% of all COVID-19 cases in Ohio were affiliated with childcare workers or children attending childcare, and that's based on the serious incident reporting data. This trend held during periods of high and low community transmission of COVID-19. You can see demarcated here by the light red and the dark red. This trend aligns with other studies that show that COVID-19 transmission is low in childcare settings. Next slide. We also found that childcare programs are ready to respond. Unlike other sectors, childcare programs had existing infrastructure to respond to a public health emergency like COVID-19. These included clear and comprehensive state guidelines for mitigating transmission within childcare settings, streamlined reporting of cases to monitor trends, provision of resources to support adherence to state guidelines, and high compliance with these guidelines by childcare workers and families. We also learned that childcare is essential for families and for our economy. We heard from interviews and focus groups that childcare staff are, quote, the essential workers for the essential workers, and that the childcare sector provides the backbone for reopening our economy. One parent interviewee stated, "Daycare's opening, give that relief to the parent that was desperately needed." When asked what would happen if their child care program closed due to COVID-19, nearly 3 out of 4 parents reported someone in their household would need to reduce work hours, and more than 1 in 2 said it would result in loss of income for their household. So based on these findings, we offer the following recommendations to mitigate COVID-19 risk in childcare settings. First, childcare capacity to fully comply with COVID-19 mitigation strategies must be sustained. Specifically, this includes capacity to maintain physical distancing and hygiene, as well as to provide for basic needs for families impacted by the pandemic. Second, the study illuminated the urgency of developing a supply chain for affordable personal protective equipment and cleaning materials, allowing childcare programs to uphold rigorous hygiene and sanitizing procedures. Third, findings highlight the role of childcare as a communication channel for reaching a large audience across the state. Standardized communication about COVID-19 should be shared regularly and may be seized to address emerging issues such as vaccination. And lastly, findings point to the need for expanding the workforce pipeline for childcare staffing during the pandemic and possibly beyond. This may require intensified efforts to incentivize jobs in the childcare workforce. I'm now going to turn this over to Mary Beth Marks, Program Manager for the Ohio COVID-19 Childcare Study. She will introduce our fantastic discussants who will ground these findings in the reality of today and provide guidance about moving forward in the face of changing dynamics related to COVID-19.
Thank you for that, Dr. Friedman. And thanks again to all of those of you who have joined today's seminar. By design, our hope was that we would bring both the study team to provide the key findings and also to assemble this dynamic panel of individuals who are really leading the way and paving the path for what this means moving forward. So taking a moment and introducing you to this panel, we are delighted to be joined by Lynanne Gutierrez, and in her role at Groundwork, Ohio, she leads the development and implementation of Groundwork's policy agenda, priorities, and strategies through communication, advocacy, research, and data analysis. We're also delighted to be joined by Ms. Carol Renee Haynes, who's an early childhood leader, nurse, educator, and community change agent. Many of you on this call may know Ms. Haynes through her advocacy work with children and families throughout Central Ohio. She also serves as a franchisee for Kiddie Academy of Hilliard, and Carol most recently opened the Kiddie Academy of Downtown Columbus in January of 2020. Finally, last but not least, we are joined by Dr. Kristie Ross, who is a specialist in pediatric pulmonology and sleep medicine. Dr. Ross serves as the clinical director of the Division of Pulmonology, Allergy, Immunology, and Sleep Medicine, as well as the co-director of the Rainbow Asthma Center at University Hospital's Rainbow Babies and Children's Hospital. Dr. Ross also served as an advisor to the COVID-19 Child Care Study team. Please join me in welcoming today's discussants. So, certainly wanting to open up the conversation and discussion, knowing that this is probably the most pressing question on participants' minds, let's try to unpack what supports are needed now to continue to operate childcare safely. And I want to open the conversation today with Lynanne Gutierrez, again, of Groundwork, Ohio.
Hi, thanks, Mary Beth, and thanks to everyone on the call. The Swetland Center and the Schubert Center have played just a really important role here, in their research, and here at Groundwork, our advocacy, our policy agenda is informed by research, whether it's the research behind early childhood development and now here in the past year around COVID-19. So I think, first of all, in terms of recommendations, I know this was already mentioned, but the recognition of early childhood educators and childcare professionals can just not be said enough in terms of the role childcare plays. They are the workforce behind the workforce. The childcare industry is the industry on which all others rely. It's the reason why I'm able to even speak with you today, and many of you on the line share that with me. And our families, our children, our community, our businesses, our economy, all are relying on childcare and the childcare workforce. So thank you to the over 90% of programs who have been open for the past year, doing your work day in and day out. And what's really important in consideration of these recommendations is that we move beyond this recognition among folks like us who really understand the critical role you play in the community and get to action. And that's what Groundwork is dedicated to doing. So in recognition of your work, it is important that policies and resources follow. It was certainly clear throughout the pandemic that the childcare system has been broken for many years, perhaps since its inception. It's not been adequately funded and resourced. And here in this crisis period of time, we're really seeing that come to light, and it's certainly a call to action for all of us. More specifically around the recommendations, I just first wanted to say that it has to begin with, or would include, from our perspective, access to the vaccine for childcare professionals. So with respect to the complexity, certainly of the vaccine distribution process in our state, childcare should be prioritized alongside K-12 educators. And Ohio is only one of 4 states that haven't done so yet. So to the 30,000 childcare professionals who are actively working, it's not just that they deserve it for their heroic work, they need it, and our families need it for this industry to continue to operate. And I'll just mention too that around 40% of our childcare professionals are people of color. And so we know the racial equity issues that have been raised by the virus. And so that is just yet another kind of equity issue behind this vaccine, and why early childhood professionals need access to it now. In terms of the resources, we know that childcare programs have not received additional support in this COVID period beyond what they are receiving prior to the pandemic since October of last year. So both in terms of the federal dollars that have been allocated to our state that we know our state is working diligently to administer, those are needed now more than ever, and certainly both in terms of our advocacy towards resources at the federal level and the state level. Now is the time. Our state budget, the Governor DeWine's state budget proposal was introduced earlier this month, and we are in the throes of advocacy to ensure not just that we're maintaining the status quo of what operations are now, but that we're recovering lost capacity that our system has endured over the past year, and that then we're actually meeting the needs of families and the professionals. So funding is absolutely required for sustainability, for childcare quality, and for childcare access. So I really appreciate the opportunity to share that kind of high level, but science drives our advocacy. And what I hear now is that, as we've unpacked the short-term needs over the past year, we thought, is this a 3-month problem? Is this a 6-month problem? We've been in this for a year. And what I know now more than ever, even with the hope of a vaccine and the active distribution that's happening in our state, is this is impacting us long into the future. And so we can't let up on our advocacy to continue to provide the resources required with increased costs of childcare programs to meet the needs of their programs, their staff, and certainly the families and children that they're serving. So thanks so much, Mary Beth.
Sure. And I think what we're really endeavoring to do on this call is to bring these various perspectives to kind of the common table here in common discussion. And I want to lean on Carol, your experience as an administrator, as you continue to navigate and pull on resources and research, as we presented earlier this afternoon. What does support look like to you? How are you thinking of that as you continue to operate day in and day out your childcare facility safely and provide this necessary service? So what is it feeling like now? Kind of where are you looking to gain support and really navigate these next steps?
Thank you very much. I do.
Carol, you're on mute. You knocked yourself on mute.
Thank you. I'm sorry. I do. Thank you very much. I do want to echo just a bit of what Lynanne said. My thoughts regarding the vaccine across all 3 of my academies. And so a bit of background is that I operate a small privately funded childcare center in Hilliard, a brand new center, as you mentioned, downtown, and then a large, highly subsidized center in Reynoldsburg. And so supports look a little bit different across those 3 buildings. And I'll tell you a bit about that in just a second. However, the need for the vaccine remains the same across all 3. What I began to really understand is that we will not be able to stand up childcare and to stabilize childcare without access to the vaccine, and really without having the ability to really outline how we are going to communicate with our staff, with our support staff, not only the importance of the vaccine, but for those that say, I may not want to get it, what that may mean to our children and to our families. And so I think a lot of that is going to start with educating, our team and educating folks within our schools and our centers to understand, if they currently right now don't have an interest, what the value of that means as we look to stabilize our industry. Regarding operating safely, We currently right now are doing everything that has been mentioned, the physical distancing, taking temperatures. But when I fall back on my nursing background and I'm really looking at our true infection control measures, this isn't new to childcare. And so I think that as we continue to operate in a more robust fashion, falling back on those things that were those basic strategies that we put in place are going to be important. But as an owner, it is a struggle to add to our budget. And even thinking of what Lynanne said, the funding and those dollars have not come in since October. And so carrying that burden of the additional PPE costs, along with all of those cleaning supplies, and even the additional staff that it takes to manage things like curbside check-in and curbside dismissal, and making sure that we have the appropriate supplies for our team from the time we open until the time we close, has put a strain on our budget. And so having the funding and those things be in place so that it's not so fragmented, you know, because even some of the assistance, and it is welcomed, have been fragmented as such. And I mean that in that our privately funded centers, the remuneration that comes for those same supplies looks a little different, but our enrollment has been down. And so, you know, that part has been tough. And so we're paid on attendance. And so with our attendance being down, our revenue again has taken kind of a tumble. And so it's been hard to maintain, I think, some of those, you know, some of those budgeted items that we had previously. It's been difficult for us to kind of keep those in place. You know, and as I look at it, I think that we want to really monitor what's going on in that K-8 space, because for us, we have a very large school age population in Reynoldsburg. And we did not see any cases when we had students that were just in our building, just in our space. But as kind of the world opened up and folks started moving around, we started to see more incidents around our staff. And so as that community spread had gotten higher, our team started to be impacted a bit more. And so we want to be able to continue to educate our staff as to what's going on in the community and how that's impacting us inside of our brick and mortar as well. And so having a strong education plan is going to be key and very important, you know, as we safely continue to move forward through the pandemic as well. And then just additional workforce supports and helping really build that pipeline so that we can maintain our staffing and so that, you know, the team adequately can quarantine as needed and not feel like it's a burden to the school or to the academy where they've got to try to look to reduce the quarantine period from 14 days to 10, although the science says you can do that. And so we're looking for those supports, I think, for us to really be able to continue, but it's definitely been a struggle.
Understand. Thank you. Thank you for all of that. And I think you've been able to kind of weave us through a number of points here. You know, something that seems to be resonating with our panelists and as we have discussed in preparation for this seminar, really the idea of, you know, the reality that one size does not fit all, certainly for all programs and providers. Certainly the same can be said for families navigating these challenging choices and times. So I want to bring to each of our discussants really the considerations that we have been needing to make given a racial equity lens. You know, how do we think through the implications both for providers and families? And I know Dr. Ross has feedback on this and really opening that up, whether it's from a communication standpoint regarding, you know, next steps around vaccination or otherwise, and or Carol, as you were mentioning, just some of the distinct differences that you've experienced even in your 3 finite locations. How are we thinking about this? How are we challenging ourselves to continue to bring next steps and considerations through that lens? So I'll begin with Dr. Ross and then can open it up.
Thank you, Mary Beth. And I want to just echo the thanks to each and every one of you who's involved in providing childcare or supporting childcare in some way. You know, both as a mom myself, a daughter who was both in a home care childcare setting and in a center before she was, you know, going to school, and as a pediatrician who takes care of children whose parents really rely on childcare and access to childcare. You know, it just means the world to know that there's so many of you out there that are providing those services and that care enough about this to join the seminar. It's really amazing to see how many people have joined today. So thank you, and a special thanks to those of you who participated in this study and now are joining. So in terms of the racial equity lens, I think there's a few things that I've been thinking about and considering. One is kind of circling back to the idea of vaccination and vaccination uptake. I think I saw some questions come through on the chat. You know, how do we ensure that people are willing to take the vaccine, that they're getting accurate information and from trusted sources? And I think we really need to rely on grassroots information and people within the childcare setting helping to communicate that. So people tend to trust information from people that they know more so than hearing it from, you know, government and more distant experts. So working to create those networks where people can get information from people that they trust, whether that's through their childcare administrators like Carol or other staff in the childcare center, from churches, church leaders, community leaders. I think that's a really critical step that it's important we think about and strategize around, because as Carol said, until we have uptake and pretty high vaccination rates, it's going to be difficult to get through this pandemic and see the other end of it. I think, you know, another concept that I've been thinking a lot about is this idea that this is, you know, I think it was Lynanne who said, first we were thinking, is this a 3 months, 6 months, you know, how long is this going to go on? Well, it's going to go on for a while. And even with vaccination rates, you know, as we're seeing the virus change and mutate, I think that most of us in healthcare anticipate it's going to be a couple of years before this is under enough control to where we can reduce the need for social distancing and masking and those types of things. And we need to be doing a good job about communicating that and doing that throughout all communities. So thinking about that and what's the best way to send those messages and communicate that, and looking to all of you who, you know, are interested enough to participate in this call to share with us your thoughts on how to reach your colleagues and other families that you know to get that message through would be very much appreciated.
Wanting to open it up to Lynanne as well. As you think about your work and certainly in your advocacy work, how does that perspective kind of impact or affect the work that you are doing? So let's go on mute.
Sorry. We've spent a lot of time over the past, particularly 4 years, focused on understanding our early childhood systems, the childcare system, from a racial equity lens and from a geographic equity lens, and from the perspective of age. So how are experiences of infants and toddlers, for example, different than older children? And so, you know, certainly when we're talking about adult professionals, childcare professionals with a vaccine, you know, I shared our position on vaccine distribution, but it is not lost on me that education and trust has to be built among different populations, including the childcare professionals, to make the vaccine a reality for folks. I think you know, one thing that is top of mind for us is, although we're speaking to the broader childcare community that serves both private pay children and kids who are subsidized by the state, is that for our publicly funded children, so children of families that are at or below 130% of the federal poverty level, childcare is a lifeline for these families. And when we look at capacity loss over the past year, we know that Black children and Black families have been disproportionately impacted. That wouldn't surprise you given the economic and the unemployment numbers for similar populations. But we certainly, and particularly among our Black babies, our Black infants, we're certainly seeing disproportionate outcomes in terms of access to care. So it's really integrated into everything we do and why we have to be such a strong voice for state investment in the child care system to support low-income working families who need this lifeline to be able to go to work and for to support their child's healthy development, because we will continue to see the outcomes of those disproportionate impacts well throughout their lifetime, certainly as a result or exacerbated by this pandemic. So, it is within all we do, and why we feel so strongly about additional resources going to the child care system.
Thanks, Lynanne. And Carol, would love your kind of perspective on the same point before we move on.
Yeah, so and in listening to Dr. Ross, that is where I have been screaming we need to go. I think with the vaccination conversation in the African American community is to go to the churches. For years, the Black church in communities has been a trusted resource, Black churches, Black colleges as well. And so if we're thinking that from an equity perspective that we may see the uptake with vaccines be less in the African American community, I think that is the place to really start so that we can establish equitable availability, education, as far as that's concerned. I think that really the risk that we take in also making sure that, for us, I have a very large Nepali population at my Reynoldsburg program. And so some of the things that I have been seeing that has changed over time, and we're getting better, is making sure that we're presenting linguistically and culturally appropriate information and not leaving out our new Americans as well. And so, we've been very cognizant of that. And so from a racial equity and ethnicity perspective, I think that we need to be very mindful in terms of, again, how we're communicating, how we communicate what's important, and then how we transition into the next phase of truly moving forward and making sure that we continue to be inclusive.
Thank you for that. I want to take a quick moment to pause. We are coming up on our Q&A momentarily. So if there are any questions or comments that you want to share, please include that in the chat or Q&A function. We're going to quickly sidestep to a topic that came up time and again in our focus groups and in our study. And so knowing that we have many study participants joining us today, this may echo some of their sentiments. And it was also something that Carol, we've discussed in preparation for this seminar, really looking at the realities of COVID-19 and some of the opportunities that it has been able to shine a light on, specifically around a supply chain or the lack thereof of a supply chain for PPE. And so I think if we could even kind of focus on that for a moment, what it really has identified, as Lynanne mentioned, many of these opportunities and situations were not new and were not a result of, but were really rather the existing structure that was in place prior to some of these changes. So as you think again, and maybe it takes us back to our first question about supports and moving forward, tell us about thoughts that you have had and how you're strategizing and thinking about ways to potentially optimize that supply chain, really looking at solutions focused on not only health and safety, but again, virus mitigation, specifically around PPE and the supply chain, if you don't mind taking that ball and running.
Absolutely. From the time the pandemic started, I've been challenged to reimagine, a more robust system. What are we missing? And one of the things, in a former life of mine, I used to operate in performance improvement and how to optimize processes. And so, when I look at us as early childhood providers, we operate in silos. And so at this particular time in this pandemic, it is causing us to have increased costs. And so the question is, what does it look like for us to build a consortium that gives us and empowers us to have additional purchasing power? We're all using gloves, we're all using masks, we're all using booties in the infant room, those kinds of things. But collectively, if we were to build a consortium and build the administrative pieces of that, what does our cost look like? What percentage does it go down by? How can that happen? And so, I think that there are enough providers in the state of Ohio that we could really make a difference and make a change. I think there's also an opportunity to see some public-private partnerships to kind of help with that as well. And so that would be, I think, my thought regarding the PPE piece and the supply chain and supply management. It doesn't make sense that a small provider, that the cost goes up 30 or 35% for your supplies because we're in the middle of a pandemic per se, when we can pull together and really have a strong voice.
Thank you for that. So we're going to open it up now to many of the questions that have come in through our attendees. One that I wanted to be specific in addressing was a question around the mask policies and the masking of children in childcare settings for those participating in the study. So I'll invite and open it up to Dr. Ross and/or Dr. Friedman just to share the background on the protocols that were in place for those programs taking part in the study itself.
Hi there. So the JFS has put out guidelines around what are the requirements for mitigation within childcare. And the guidelines have face coverings are required for employees and for all children in 3rd grade or above. I can put something in the link in the chat about this. This is something we asked about during our interviews and focus groups. And I think there are certainly, and definitely Lynanne and Carol could share more about it, childcare programs that have actually incorporated use of masking even at younger ages than 3rd. Oh, you're on mute.
Sorry about that. Our policy requires that all of our school agers, so anyone that is in kindergarten, to wear their mask. Our preschoolers are at the discretion of their parents, but it is recommended. What we have found is that they do really good before nap at the preschool age, but after nap, they're kind of tired of the mask. And so the compliance decreases. And so, we ensure that our school agers K-7, K-8 have their mask on, and our 3- and 4-year-olds, we're pretty flexible with them, especially throughout the afternoon.
Thank you. And I think Dr. Ross has a little bit more on mask protocol as well.
Thank you. Yes, masking does work. We know from studies outside of Ohio, and particularly in schools and in childcare settings, that when there are not mitigation strategies in place like masking and distancing, that we do see clusters and outbreaks. And we saw that in healthcare settings prior to the institution of universal masking, really more between employees. So if we weren't masking when we were around each other, and not around patients, we saw clusters and outbreaks. So we know that masks do work, and children, in this young age category, it's amazing what they can tolerate, but of course they are young children. And I love the way you described that, Carol, that after nap, they've used up all their ability to tolerate it for the day. And that's why, as we've been talking about everything else that we can do to support childcare, including vaccination, is really critical, because this is a special population. They really do their best, but young children it's just very difficult for them, in addition to older children who have special needs. I think the other unique thing about childcare is it's a very hands-on job. I don't have to tell any of you who are in that, in this role, that you cannot stay 6 feet apart from the child that you're taking care of. So having access to PPE, including good quality masks, and getting vaccinated is really the best. Those are the best strategies that we have to prevent outbreaks and clusters.
Thank you. Well, go ahead.
I just want to add, and not because from specific experience, only with my 2.5-year-old, but I really appreciate this question, because so much of the conversation around the impact of the virus has been about adults. And I think it's just a really good reminder that kids are at risk too, and kids don't have the same tools available to them to protect themselves. That's on us. So back to that idea around what are these long-term implications? How long is our lives going to be changed? We continue to really think about the kids. So even if we had 100% of all childcare professionals vaccinated, and they were, and there's a better community response, our kids, we still have to protect our kids. And so I don't speak as a scientist. I'm sure the doctors have something better to say on this, but we continue to be really concerned about the health of kids and families. And so I just don't want to lose sight of that as adults begin vaccinated.
Hear, hear. It'll be a while before children, can get vaccinated in this age group. And so absolutely, that's a really great point, Lynanne, and thank you for bringing that up.
Awesome, thank you. Well, another question that has come in that I want to open to our discussants, but also to our active panelists here, or participants, given the number of childcare providers and administrators we have joining. The question is really around how centers are currently handling staffing, and how do you think about staffing when staff members do have to quarantine, given the challenges being down 2 to 4 teachers, how that impacts your ratios, how you maintain those ratios, and how do we think about that? Again, building off of study recommendations about the staffing pipeline, but also just the day-to-day realities of maintaining a ratio while also keeping staff healthy and quarantined. So again, panelists, I open it to you, and then also participants, as many of you are living and navigating this question day in and day out. Please feel free to chime in. So we'll start with Carol.
Thank you very much. Certainly. What we did probably starting in October has been very effective for us, which we looked at and established basically a group of floaters that really are covering classrooms. And I know that folks have said, not to share staff, but during the quarantine, that becomes that core team in the classroom for those, which had been 14 days for quite some time, but for those 14 days, that those group of 2 became that group's teacher, so to speak. And so we didn't necessarily consider it that we were sharing teachers classroom to classroom. So we had a core team of floaters that are covering really just quarantines during that particular time. And that's been very effective for us. As recent as today, we had the first time we were so short at one of our buildings that we had to actually borrow staff from another program to cover that particular time. We have had to close because there weren't any staffing options for us that were reasonable or that we thought would be safe. And so that was as recent as last Friday. We had to close for 1 day just because of the overlap we weren't able to cover. So the reality of it is that there are times that you'll be able to figure out the staffing coverage, and there's other times, such as we had last Friday, that we did have to close the program. We do try not to do that because for us, we serve a ton of essential workers, and they cannot afford to be off work. For them, missing a day of work means that they may not be able to pay their rent at the end of the month. And so the loss of that 8 or 16 hours is vital to how they proceed. And so really just building that float team that really covers our quarantine period is what we look to do during that time. And that's really what they do. So they no longer are just floating the building, they're covering any quarantines we may have.
And Mary Beth, I'll just add, this was a major theme that came out of the study. I mean, and again, our study, most of our data were collected even by the end of October with administrators, for example. And there was strong concern about having staffing capacity. This was even before the community transmission rates went up in November. And that's why you saw that focus on pipeline development and making sure staffing were available. And I want to, reiterate, because this is something we kept, asking administrators. You say you have lower classroom sizes, but you need more staff, and that was hard for people to understand. But like Carol said earlier, a lot of new staffing needs have come up because of COVID-19 in childcare. So the pick up and drop off, temperature checking, also because of the not mixing, you used in the beginning of the day and the end of the day, maybe you could have reduced the number of staff because you can combine classrooms, but you can't do that anymore. And with reduced number of kids and equal staffing needs, or even more, you don't have the revenue stream to cover the full cost of all of the fixed as well as variable costs. And so, I do think this is a really important point around staffing, and I think an opportunity as well, like Lynanne, you said, is a broader agenda. How do we think about if use the lessons learned from COVID that apply to broader conversations about childcare staffing needs?
Yeah, from our perspective, I mean, this is less on the day-to-day kind of interpretation, implementation of the regulations, which, I have heard a lot about, and the one shared sentiment is that I know that child care professionals are really just doing their best in the moment to make the smartest decision that's best for their families, kids, and staff. But the broader issue around staffing, it's pervading our entire system. And when we look at average wages, again, of childcare professionals, the average wage in our state is $10.67 an hour. So you have very passionate, highly skilled people in this field who are the lifeline for families and kids, who are not being paid minimum wage, and who have been asked to be heroes in this pandemic, and they absolutely have been, but obviously have additional responsibility and concern and are taking on additional risk to do their job. And the idea that they can make more at the grocery or at Amazon, whatever it may be, we are asking so much on the backs of childcare providers, and we always have. And so that is something from a resource perspective that fundamentally has to shift if we're going to solve any of our childcare problems.
Well, and let's keep going with that, Lynanne. So a few questions that we've received, and I think very much the intention of today's seminar is this focus on moving forward. And so would love to really discuss and to pinpoint some of the best resources and avenues for advocacy. I think given the representation we have in today's seminar, helping to better illustrate and understand the most effective ways for reaching out and really driving some of these initiatives and the needs for some of this implementation forward. So if you don't mind putting on the advocacy hat that you wear so well, what does that look like? Where can we really take motivated, frustrated, impassioned individuals to move them to action? If you can walk us through that while we have a few remaining minutes here.
Yeah, absolutely. So There's 204 of you still on. And so if you didn't know it, even if you identify as a researcher, as a child care professional, whatever your background, skills, and training is, you are an advocate. And state policymakers and federal policymakers expect to hear from people like me all the time. And I try my very best to do you all justice. But the truth is, they need to hear your voices. And that is going to be the difference maker in whether this moment, this extended COVID-19 moment, if you will, that keeps extending a longer and longer time period, becomes a movement. And so while I know many of you, perhaps depending on the day, feel defeated around some of these really large structural changes that have to be made, there is an opportunity here to build back better and to really shift thinking around priority in the child care system. So my invitation for all of you who have different day jobs that aren't mine, that aren't advocacy 100% of the time, is to engage with us, connect with Groundwork Ohio. I will re-put the link in the box, but we provide a weekly update that has both opportunities for you to learn more and get the most up-to-date information on what's happening at the state and federal levels in terms of policy, but also we have spent a lot of time and put a lot of thought into how to make it easiest for you to advocate. So when we ask you to engage, it's because, number one, we think we're at a critical point in time where your voice is going to make or break the difference. And we have made it very easy in terms of platforms and technology for you to spend, take 5 minutes of your day. I know you're busy, tired. Take a few minutes of your day to lend your voice to a particular action item, because both in terms of the quantity of voices we have and the quality of your stories, I just say, like I said again, I cannot do justice to your story alone. Our team can't. And your stories are what policymakers need to hear. So help us make this moment a movement, and I'll put the link back into Groundwork Ohio. The state budget process is going on right now. We have a new federal administration. Congress is considering a lot around the needs of young children and families. Please engage with us. We need you.
Thank you. And before I turn it back to Dr. Dimitropoulos, I do want to open it up to our discussants and our research team. If there's any final thoughts or things that would love to be shared before we close out this afternoon's seminar.
I just want to say thank you. I think that the conversation that was happening on here is really exciting, and there's a lot of great feedback, and channeling that energy in a collective avenue, I think it could be extremely productive.
I agree, Dr. Friedman. I don't know that I have anything else to say other than I am so thankful for the work that you all have led during this really difficult time period. And for those of you on the call who know anything about research, I will just say that it is impressive. It was impressive to see this very fast-paced study conducted in the manner that it was by Dr. Friedman's team. I want to thank all our panelists. I thought we had an incredible discussion today, and I would like to thank all our participants who participated in the chat and shared their thoughts. We will make sure that you have access to these resources after the call. I would encourage you to reach out to Groundwork. I would encourage you to reach out to the Schubert Center and to the Swetland team if you have thoughts to share with us and directions for us to go as well. So thank you to all the panelists and to everyone for today's such wonderful discussion.
And I would like to thank everyone and thank you guys for having me. As we go, I just want you guys to definitely keep our teachers and our providers that are in each and every one of our early childhood classrooms in mind, and pray for them and their strength. There's a lot of fatigue out there and a lot of frustration as well, but there's also a lot of love and smiles that are being given away each day. And so definitely keep them in mind, and any strategies that we can put in place to help them. So.
Very well said, Carol. Thank you, everyone. Have a great afternoon.